Hello, my name is Nathaniel Fernandez, and I'm part of the Louisville Institute Collaborative Inquiry Team. We're exploring issues around mental health, hospitality, and the Christian church. So today I'm going to talk to you about masculinity and mental health within Latinx communities. So you start off maybe doing a little bit of research into the connection between mental health and masculinity, especially within Latinx churches, and you can sort of immediately find that it seems that the two are at odds with one another, right? That there's some kind of contradiction. We can either lean into our masculinity or we can have good mental health, but not both. And I want to tell you that that's a false dichotomy. That's not true. And what it comes down to is sort of breaking down what we mean when we talk about masculinity. So I want to talk today about machismo and caballerismo and the differences between the two and how they each interact with mental health. So many of you may be familiar with these terms already. They're, regular terms, but they have an academic meaning as well. And so when academics talk about machismo, we're talking about ideas such as real men never let their guard down, or the birth of a male child is more important than a female child, or it would be shameful for a man to cry in front of his family. And we've seen that these are associated with poor mental health outcomes, things like aggressiveness or even number of times arrested, right? Whereas on the flip side, if we think more about some of those caballerismo values, those gentlemanly values, like men should be willing to fight to defend their families, or the family's more important than the individual, or men don't need to brag about sex. These have actually been shown to be associated with positive mental health outcomes, right? Things like better emotional connectedness, or better relationships, or even just better satisfaction with life overall. So I want us to kind of start having a conversation, even start it today with your small groups or however you are able to talk about these things. We need to start thinking about what it means for us to be men in the Latinx community, right? And how that interacts with mental health, and what we want to bring forward and bring to better ourselves and our families, and what it's time to take another critical look at. So I encourage you to talk about that today.